I call it the home health education gap. It's wild. So we go to PT school. I went to USC for 4 years undergrad. Then I went to USC DPT program, #1 school in the country. 3 years. I come out, 0 classes on home health, 0 education on home health. Don't know the rules, don't know the regulations, literally know nothing. We do clinical internships almost every semester or whatever those periods were. I can't remember. I'm too far removed. Very few opportunities in home health. I don't know if we had a single one. I certainly didn't get one. So that piece is completely absent from the PT, OT programs now.
Kick it.
Welcome to Strata Stories. My name is Thomas Schreiber, and I'm the Director of Marketing here at Strata PT. Strata PT combines your EMR and billing into one automated system to increase revenue and achieve a 99.99% reimbursement rate for physical, occupational, and speech therapy clinics. On today's episode, Paul Singh, the CEO of Strata PT, talks with Zack Pevnick, President of California Therapy Services. Paul and Zack explore the nuances of home health physical therapy and how to diversify revenue and staffing to withstand policy changes, acquire more patients and increase their value, and how to market correctly to home health agencies. If you'd like to learn more about Strata PT and see how our EMR and billing works, head over to stratapt.com to book a demo. Now, without further delay, here's today's episode.
Let me just get the 30-second version first off of what is it that you do? What is California Therapy Services and home health staffing? Like, what is that? Let's just give me the 30-second version, and then we'll kind of we'll start peeling the layers back.
Okay, cool. Yeah. So California Therapy Services, we're a home health therapy staffing company out here in Southern California. We send physical, occupational, and speech therapists to patients' homes throughout, like I said, a large part of Southern California. Home Health Leaders is my consulting company where I help therapists both be successful in home health as a solo therapist, as well as for the people that want to create their own staffing company, teach them that model.
Yeah. And this is probably stuff that like you take for granted, right? But like the thing I find really fascinating in this particular industry is that like, you know, and I think I saw this somewhere in your socials. I can't remember if it was on one of your Instagram posts or somewhere, but you know, the synopsis of, I think you were telling your story or something like that in one of your older posts or something like that. And the storyline, as I wrote it down, was like, you know, after you graduated PT school, you had some bad experiences, and like you were basically saying like that, like what you. And you said it more eloquently. My takeaway from it was that you were saying that you came out of PT school knowing how to do PT, like the hard skills of PT, but what I would call the soft skills, like there's all this other stuff that nobody really trained you on. And that I think is really fascinating because I've only been in this healthcare industry 3 years. And I mean, I feel like I picked up on that real fast. I'm like, how is it that all these PTs are so smart on paper, but like completely unaware, for example, of the importance of local marketing? You know, like they set up their shop and then they wonder why like patients don't show up. So I thought it was interesting. There wasn't really a question there as much as it was just kind of like that. I remember as I was scrolling through your content, I was like, oh yeah, this is interesting. This is really interesting. So maybe let's start there. So, you know, when you talk about, when we take that story, your story, right? You came out of PT school feeling like you knew how to do the work of PT, but that there was something lacking. What was that? Like if you were able to design, let's say, the modern day, you know, training programs or educational programs for PT in the university setting, like what would be some of the topics or classes that should be in that? Again, maybe I don't know if that's the right way to ask the question, but maybe let's start there. Like, you know,
yeah, I mean, like, oh, go ahead.
Well, I was going to say, like, this is going to sound horrible, right? But let me just kind of say it to make the point. Technically, your business shouldn't exist. I say that with respect, by the way. That like the only reason your business exists is because there's a gap in what's already there, and so the poorly articulated thing that I'm trying to ask here is like, what is missing? Like, I've never been to PT school, right? So I just imagine it's like a bunch of medical training and stuff like that. But what was missing when you came out?
For me, and like anyone that wants to go into home health, I call it the home health education gap. It's wild. So we go to PT school. I went to USC for 4 years undergrad. Then I went to USC DPT program, #1 school in the country. 3 years, I come out, 0 classes on home health, 0 education on home health. Don't know the rules, don't know the regulations, literally know nothing. We do clinical internships almost every semester or whatever those periods were. I can't remember. I'm too far removed. Very few opportunities in home health. I don't know if we had a single one. I certainly didn't get one. So that piece is completely absent from the PT, OT programs now. The other part of that is what you were kind of like referencing, like the soft skills. Like there is no education on how to make a cent back after therapists have paid 6 figures, go to school, get a couple letters after our name. And the truth is most are left with like crushing debt that they typically really, really struggle to pay back. And that's like 2 things that are just absent from our programs. And it seems like that would be so key in their success outside of just clinical knowledge. And clinical knowledge only goes so far.
Well, it's interesting. Like now I might have had a unique experience, but I did my undergrad in computer science and electrical engineering at George Mason University. And one of the things I remember viscerally is in the last year of your undergrad, there's I think it's like a 2-credit course, and maybe it's different now, but 20 years ago, there was a 2-credit course or something like that you had to do in their last year. And I think it was ECE 491. And it was like, they didn't talk about entrepreneurship and they didn't say the word soft skills, but that entire 2-credit course was about taking the body of knowledge that you had gained around electrical engineering and all these things, take the body of knowledge that you gained over the last 4 years of your undergrad. And it was real world case studies of, okay, here are some sample projects you're going to get. And here's how you're going to communicate the results of your research or whatever. And I remember at the time I didn't appreciate it. I'm like, what in the world? Like, writing? I mean, this is like in the late 90s, right? So I'm like, writing? Are you kidding? I thought we were all engineers. We like make stuff. But that entire course in hindsight was really about like, okay, you're not going to get $1 million budget to prototype something. You're going to be given a task that looks like this. And then you need your output's going to look like that, like literally a paper that describes it. And oh, by the way, you're going to have to make a pseudo business case study. Like we didn't have business school. This was not like an MBA or, so anyway, the point is like, maybe I had like a one-off experience, but I think, my understanding now is that most engineering schools do this, that there is at least a transitionary class almost always. I have friends at Purdue and other places that have confirmed this. Anyway, point is, it's interesting to me that like that didn't exist for you at the PT level, because operationally I could tell you like, and again you've been in this longer than me, but operationally I can tell you that home health is a different beast than outpatient ortho or outpatient therapy. But as a fresh graduate, I don't know that they know that. Like they don't. It's amazing to me that is the case. So, home health. If I were to time travel back, what did you always know home health was the niche you were going to go after, or like how did you end up there?
So originally it wasn't. Like I grew up in a therapy family. My dad is a physical therapist. He owned multiple outpatient practices, hospital, developmental disability facilities, and he did home health. So he did a bit of everything. He was like one of the first guys to go into private practice, I think in the 70s. And so I grew up in this world. And I always imagined, I wanted to go into sports, ortho. So that was what I kind of planned on. I went into outpatient orthopedics, sports medicine clinic, 3 years. And the model just didn't align with what I was trying to do. Like I was seeing up to 20 patients a day, 5 patients at a time. I was paid $16.53 a patient.
Oh, per patient, not even like per hour, per patient. Wow.
If you broke down my salary and I would see up to 20 patients a day, $16.53 a patient. 7 years of PT school, 6 figures of education, multi 6 figures of education. Like it didn't feel in alignment with me. And so I wanted to check out a setting where I felt that the more visits I did, typically in home health, the model, the more you're paid. So I felt very in line with that. I knew I always wanted to have my own company. So if it wasn't going to be in the outpatient realm, home health presented a great opportunity in that the startup cost is so low. The risk to start a company like this
Right.
is like a few $100s versus office space, equipment, staff, front desk, all this stuff that comes with a brick and mortar facility. So that's kind of why, no, I didn't plan on this 10, 15, 20 years ago, but that's where the road kind of led me.
I appreciate that you're willing to talk about money, by the way, too. I think that's one of the, and I'll probably lose some friends on this one, but I think one of the many observations I've made, again, I'm so new to the industry, I'm only 2 or 3 years into it, but I feel like one of the most common things I've seen so far is that like it's almost taboo to talk about money. You're supposed to, it seems to me like PTs and OTs and all these folks, they're trained in such a, like, I don't think anybody ever told them not to talk about money. I think on the flip side, what's been indoctrinated into them so much probably is this idea that they're there for better patient outcomes. They need to create, healthier patients. And that's a very noble thing. But it's like talking about money is taboo, like so I definitely appreciate you being willing to talk about that. So the other thing is, you are, the way you just casually talked about startup costs and how low they are for home health and stuff like that. That's also pretty rare. Nobody really ever says that. What's the other side of that though, right? Because like in theory, it's not like, and I'm not trying to like, this is not a loaded question, but just to kind of like make sure that we're setting the stage here for people too. It's probably not always, unicorns and butterflies. Like, yeah, it's easy to, from a cost standpoint, easier to start a home health care kind of service. But what are some of the downsides of it? Like, what are the pitfalls? What are the challenges? Maybe challenges is the right word, probably. Like, what's the other side of it?
Yeah. I mean, we're all business owners. Like whenever you own a business, there's difficulty. I was on a call yesterday with a client. He owns a company actually in DC. And he's like, man, 3 weeks ago was really tough. We ran into this case with our number one referral source where the girl that usually sends us the patients left. And now there's someone new in there and they're not sending us the patients and they're doing everything wrong. And that's something that's really common in my industry is it's essentially B2B, right? Like we're partnering with other entities, with home health agencies. They send us referrals. That's the model. And because that's the model, we lose some control of the whole picture because we have to work with so many other businesses. Early in my company's career, this lesson, I talk about this all the time because it transformed everything for me when I figured it out. And I almost lost everything 3 times because I was stubborn and I didn't figure it out the first 3 times. But diversification is like the most important thing if you're going to get into this industry. Because your best home health agency now that sends you a tremendous amount of referrals and can provide you a ton of business can be gone tomorrow. And it's nothing that you did. And I had to learn that lesson over and over, like I said, until the 3rd time before it truly clicked. But when I talk to other owners of home health therapy staffing companies, it is so typical almost every single time that I think it's the Pareto rule, 80% of their business is tied up with 20% of their agencies. And it's honestly usually 95% of their business is with one agency is the typical one. And it's a super dangerous place to be. And it can be you ask like, what are the tough things? What are the downfalls? Like that could be a big one.
Yeah. One of the things I like to think about, and this is, I'll say this rhetorically, but if you have any comments on it, I'm curious, but I'll say it rhetorically to not put you on the spot. I would argue that if more, and I'm going to use the term therapy practices to be the broad term, so to include home health and outpatient and all that. The assertion I would make is that if more of these therapy practice owners would see themselves as a patient acquisition company that happens to deliver great care, they'd probably run way more profitably, have a much funner business, and be much happier in their lives. But the vast majority of them, if you just look at what they're doing, they're operating the other way. They are a healthcare provider. They've put their shingle up, whether it's a magnet on the side of the car or like literally a shingle in front of some space they sublet. And then they like sit there and they just assume that like patients like me are just going to show up. So yeah, magic. Yeah. And so, the other thing I'll say is that, it's so interesting, and maybe I don't feel old, but I'm only 43. But the more you spend time in your career, like in looking at industries, at least what I've come to find is that everything repeats itself, and every industry, as much as they think they're different, they're kind of the same. So, for example, what you talked about in terms of referral diversification, what we call that in the tech industry that I come from is we call that third party relationships versus first party relationships. And if you and most people don't think about it this way, but just to make the point, third party relationships are like, in using your example, it's the referral partners. And there is a certain risk that always exists, whether you acknowledge it or not, that those things can go away. They find somebody else they like referring to better. Or in this case, the person that actually would send you the leads left, and now the new person in that role doesn't care about you. They're just going to send them somewhere else. So, but in our industry, we call it third-party relationships versus first-party relationships. And the general theory or the general consensus in the industry is you do have to, it's not like one is always better than the others. You have to use third-party relationships, especially when you're getting started, but you got to really keep an eye on, or at least put your mind on this idea that every third-party relationship is ephemeral, temporary, and it's on the business owner to then build a first-party relationship with the customer, in this case, the patient. So anyway, more of a diatribe there, but it's so similar. What about, I think you were alluding to this, but I just want to make sure I don't misunderstand. I think you were, as you were talking about that thought that you had, or that idea that you had there, I think you started to allude to this idea of also revenue diversification. Did I miss that? Or, okay, you're nodding. Yeah. So can you talk about that? Like, what does that diversification on the revenue side look like? Is that like, I'm going to make this up. Is it like selling exercise balls or something? What does revenue diversification look like for home health in that context?
Yeah, so for like a home health therapy staffing company like me, the general oversimplified model is we make contracts with home health agencies. We bill them a certain rate. We make contracts or employ therapists at a certain rate. And then our margin is in the middle, right? So like when we talk about like the revenue, it's all volume based from patient visits. So the more visits we do, that's in direct alignment with our revenue. And of course, the rates we charge and all these things are levers we can pull, but that's the model. We're not selling TheraBands and, extra products and things like that with our model. As far as the diversification piece with the revenue, like just to hammer this home, like the first time I didn't learn my lesson, we worked with a massive, I think the $2 billion acquisition a few years ago, home health agency. They have, at the time they were in 10 states, tons of offices throughout California. We were with a couple of them. The office we were in was the number one therapy money generating office in the entire country because we were doing a ton of visits with them. Management changed, rules changed.
Yep.
And, we went from back then like $50,000+ a month to like $2,000 a month. And that happened within like a 60-day period or something. And at the time, it was a really big part of our business. That was in the early days, like it was a huge part of our business. I didn't learn my lesson because we had another huge agency that like was ramping up at the exact same time. So it didn't hurt that bad. But like I said, like there's a million reasons why you can lose a partner, and often it has nothing to do with you. So the second big company, we were doing over 60,000 a month. PDGM, huge regulatory change happened in 2020. Same deal. Went from 60,000+ a month to $600 within like 60 days. So that's why I talk so much about diversification of referral sources, because it's nothing that you do wrong 95% of the time. But if you don't have a bunch of different sources and you lose one like that, it could seriously be the end of your company. You're not going to be able to pay people. I've, thank God, never been in a situation like that, but a lot of companies get there. And it's just a lesson that if people focused on, they wouldn't find themselves in that situation.
And I agree, by the way. Okay, so you can totally talk to me like a second grader, but when we think about that diversification of revenue, generally speaking, I know like there's no, like everybody's business is different, but generally speaking, as an industry for home health, like, are we talking about, when I know you talked about like there's like contracts with the home health care agencies and stuff like that, but by and large, are most of these dollars that are flowing through the system coming as like, insurance reimbursements for the care, or is it like cash pay coming from the patient? Like, where, just generally speaking, as an industry, where's the money coming from?
Yeah, as an industry, it's coming from Medicare and now managed care contracts. So,
right, that's okay. Yeah.
So the agency's billing Medicare, Kaiser's HMO, Blue Cross, whatever it is, they get reimbursed, and then we're paid a flat fee per visit is the way we set up these contracts. And, net whatever many days kind of deal is how the term's set up in the contract.
Yeah.
So we are not directly contracted with Medicare, insurances, anything like that as our entity, but the agencies are, to kind of break that down.
I come from a world, when we think about e-commerce or any of these other like tech companies, like for anybody watching this right now, whenever you think of a successful tech company in your mind, just pick whatever company you want. It could be, I don't know, it could be Twilio, it could be Facebook, it could be whatever you want it to be. If you were to go sit inside those boardrooms or those offices, and you watched how they talk about a user, let's use the example of, just for the sake of argument, let's use the example of Facebook. To you and me as individuals, Facebook is perceived to be free, right? I mean, you and I as individual people, guys, whatever, we don't pay Facebook to post pictures of our kids or whatever. But Facebook drives a lot of dollars. And the business model of Facebook, for example, is that by creating something that, allows us to doom scroll or share pictures of our kids or whatever, they've created an engaging platform where we hang out, for better or for worse. And then on the other side, they have an ad platform, for example, that allows, I'm going to make this up, Procter and Gamble to throw some of their ad dollars in and target, whatever Procter and Gamble wants to sell to a 43-year-old male that happens to live in Virginia. And so if we were sitting inside that office at a company like Facebook, and I think you can see this in their public earnings reports as well, is that they actually assign a dollar value. They say that the average user, and I don't have it handy with me right now, but just for the sake of discussion, they'll say the average user is worth, I'm going to make this up, $11 per month in revenue. And so that's the way they think about it. They think about this idea that if they can engage, I'll just use myself, if they engage Paul and create something that allows me to be, or that makes me want to be a desirable person, that makes me want to stick on the platform, use it, whatever. On the other side, they know they're going to make $11 a month from advertiser revenue on me. Then you can extrapolate that out and realize they have 1.5 billion users. That's why it's so big, right? Nobody in healthcare. Now that I've set that up, here's the poorly articulated question. And again, you can take a pass on this if you don't want to touch this topic, because nobody I know yet seems to be willing to want to talk about this. I have yet to meet any, practice owner. Like, and let's just be very clear about this. Like, I think hospital systems are thinking the way that I'm about to ask, but I think I've yet to meet like an individual practice owner, whether they own 15 or 20 clinics or even just one, that thinks of a patient in terms of customer acquisition cost. Like, what did it cost me to go get that? And the cost is what your time to go get that contract and all these things. So I've never heard anybody talk about the cost of acquiring a patient and the really taboo subject, the lifetime value of that patient, and one more example before I stop this and see if you want to bite here. let's use Netflix, because now that I think about it, Netflix is probably an example that everybody's aware of. Everybody, I think, knows about Netflix. If I sign up for, and this is all in their public earnings report, so anybody can go Google this and find it. If you were to look at Netflix, and I don't know what it even costs at the time of this recording. It's like whatever it is, $20 a month or whatever. They have a model that's very clear. It costs them X dollars to acquire me as a subscriber. And they know based on their data that on average, I will stay for, let's call it 5 years. So to them, I'm worth 60 months. I'm just making up the numbers. You can go look at the public earnings reports, but 60 months times $20 a month, you can do the math, right? Like I'm worth that much to them. That's called lifetime value. So my point I'm trying to make is that the tech industry over the last 25 years has gotten really scary good at figuring out the economics of what a user is worth in terms of dollars. But healthcare doesn't seem to think that way. And I remember when I first started getting exposed to this industry, I'm like, I'm a runner. I find it cheaper than therapy and all those things. So I try to run one marathon every quarter. But statistically, that gets me into my PT's office twice a year, because twice a year with the amount of running I do, I've done something dumb. And what I didn't realize, like I'm just, as a regular patient, I just walk in and hey man, here's my, in Virginia, it's a direct access thing, right? So, hey dude, here's my insurance card. My knees bother me. What's up? I don't think anything of it. He says, okay, I need your $20 copay and blah, blah, blah. It's just magic, right? And I feel better, and it's 6 visits. Then, I admit I'm maybe not the most diligent human being in this country, but I never thought to look at the EOBs. And then I realized like he's billing 100 or whatever it is to the insurance every visit. And statistically, I'm going in twice a year, and each of those episodes is like 6 visits. I'm worth $1,200 to him a year. But nobody talks like that. So now that I've laid all that out, you can bite on this or pass on it. Why aren't practice owners thinking about this? Like you're what I find refreshing about you is like this is our first call for anybody to know. Like we don't have a business relationship. I don't know you. You don't know me. But like you're one of the first people I've met in all these years that just so casually just talks about money. You're like, yeah, home healthcare. I used to make this much. I can make this much. I can make more money by seeing more patients. Like you're talking about it. So now you put yourself in a position where I'm going to ask you that awkward question. Like, why is it so, maybe the question is, why is it so taboo to talk about money? Or maybe like, why aren't practice owners thinking about lifetime value of a patient? Because the answer to this will back into that other topic that we just talked about. Like why doesn't revenue diversification include getting deeper into my pockets as a patient? Anyway, poorly articulated question, not enough coffee today, but anything in there like worth touching on, or do we want to skip this topic?
No, 100%. I can't believe people want to pass on that. I mean, it's incredibly important. And I actually wanted to loop back to earlier in our conversation, the money topic, because I think you're right, especially in PT, especially in therapy. It has been so taboo for forever, except for among the small group of profitable business owners. But now I think with social media, it's a good thing. It's probably a good and a bad thing, but people are becoming more knowledgeable about it. And I think they're starting to speak up and kind of know their worth, which is, of course, an amazing thing. As far as like those other topics that you talked about, like CAC, LTV, and all these things, yeah, a bunch of companies don't talk about this, especially in home health. Like, I haven't talked to anybody who's talking about lifetime value, cost to acquire a customer, and these things. But like, look, it's an old school industry, and like I do old school marketing, I do new style marketing, right? So like, I've got all the CRMs. We developed our own staffing software. You mentioned Twilio. We integrate through Twilio, and like, I'm very tech savvy in that stuff. But some old stuff works. Like we send these mailers out, and like I know how much to send this mailer to the top 500 agencies in my market cost, and I know how many calls I have to do to follow up. I know how many.
It's just math, right? Yeah, it's math.
Yeah, and so like if we can call this a campaign because it's these old school mailers.
Well, that's what it is. Yeah. Yeah.
Yeah. If this campaign, the numbers don't make sense, we're not acquiring new agencies, which ultimately means we're not acquiring new patients. Like, I got to kill that campaign. It doesn't work. When I talk like under Home Health Leaders, I consult with a bunch of different business owners. A lot of them own mobile outpatient practices. And for whatever reason, they want to get into the home health side as well. And so I talk to them, I say, like, I know you may have trouble acquiring patients. That's often a difficult thing for like startup mobile outpatient practices, or they don't want to market to doctors, or they don't want to do XYZ to get patients. You know, they go to gyms and do free assessments. They don't want to do those things. I say, cool, let's get you into home health. We'll make the contract so that without having to market and do all those things, like you just get a bunch of leads, a bunch of patients referred to you. And then the beauty with your current business of an outpatient mobile company is when they're no longer homebound, you can enroll them in your outpatient mobile practice. You can continue to provide excellent service, get them better so that they're not being re-referred 6-9 months later. And it extends the lifetime value of that patient. So instead of just seeing them in home health, this portion of the story, or just seeing them in outpatient mobile, this portion of the story, you've captured that patient for that whole experience. You're able to bill more. You're able to provide more impact and value to the patient as well. So it's an important topic, and anyone who isn't talking about that is probably shooting themselves in the foot.
100%. Yeah.
It's funny. I went to a physical therapy conference 2 years ago, and this was actually, I didn't even know this existed. It's always like CEU classes, someone teaching about ankle pathology. Like, I found a business-minded PT conference. I was excited. I bought my ticket, VIP boot camp for the extra day before. Like, I did the whole thing. And the main guy who threw it, he said, like, raise your hand if you see yourself as a therapist. Every single person, except for me and this other guy who has 12 practices, put up their hand that they're a therapist. And these are people that are starting cash practices for this one. We were the only two people that didn't identify as therapists because we were business owners in our head. And that's the switch that so many providers won't make. And it's killing them. And it's why they have to work for 40 years. You know, if they don't want to be seeing patients, they still have to see patients, and they just don't figure out the financial part.
Yeah.
And it's a problem.
You know, it's this might be an entirely different episode that we can do together at some point. But one of the ideas that keeps coming into the back of my mind that's tied to what you're talking about is like, you know, it's like, what would the modern day business school look like for practice owners in 2025? And, you know, again, this could be a totally different episode that we do at some point. But like, the thing is, like, let's just use technology companies as an example. 15 years ago, so 2010, there was this realization in the tech industry that, you know, that access to capital was getting easier for more and more people that wanted to start a technology business. It was also becoming clear that the cost to start a technology company was dropping very rapidly. Like, you know, it was like, I would always tell people, I think $5,000 in 2010 was the equivalent of $5 million in 1995. And that's a different episode entirely we can talk about. But what you're talking about here alludes to the same idea. Like, what does the modern day business school look like for practice owners? And if I was just shooting from the hip, I would say literally 0% of that modern day business school for practice owners would have anything to do with clinical care. Well, you know what? Now that I say that, maybe 10%, because, you know, there's the soft skills of bedside manner and all these other things that probably could use a little bit of love. But the other 90% probably have to do with distribution, meaning like, how do you think about marketing? How do you think about campaigns and tracking ROI? Just like you just described there. These are topics that like every other industry has figured out. Like and this is going to, maybe this will piss off somebody, but like there's a real estate agent in my neighborhood. So I live in a very modest neighborhood, like probably most Americans. It's probably 300 homes in this subdivision. And of course, there's this one dude who's like he's like for the 10 whatever years I've lived here, he's like the guy, he's like the realtor that tries to be the guy for this neighborhood, right? Like Kevin's like the guy. And, you know, I joke that like, you know, I get him, the guy lives like 3 streets down, but, you know, I'm just part of his campaign. He's sold 3 of my homes over the years. And he sends the high school football calendar and all these things that Kevin's face is on the side of my fridge and all this stuff. And I bet you, if you and I right now walked over to his house today, whatever, and I said, Kevin, hey, that mailer that came out yesterday, what was the ROI? He could probably tell me, I bet you money, he would tell you, okay, it cost me this many dollars to send it to 500 homes. I got 3 new listings based on it. I'll probably sell one of those. So blah, 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 right? But practice owners don't think like that yet, but like the tech industry does, real estate agents do, dentists do, optometrists seem to be thinking that way. So it's just a matter of time. And I think there's this idea of like a modern day business school, and what does that look like? It's probably going to be a virtual anyway. So a little bit of a rant, ramble, whatever.
No, I love that story because you won't believe this. That's why I looked over here. My first business coach I got, I don't know, like 4 years ago, something transformed my business, opened my eyes. And I'm opening this letter right here so I can show you my story, which is like, this is going to be kind of crazy. But my first business coach, there's nobody in my industry doing what I do and teach people how to, reach financial freedom and home health. There aren't business coaches in this sector. So like I found what was closest to me, which was Keller Williams, huge realtor company throughout the country. He ran the biggest branch, 400 real estate agents. I said, okay, cool. This is pretty similar to my model. I've got hundreds of therapists throughout Southern California. This branch has hundreds of real estate agents throughout Southern California. This guy probably has something I can learn. One of the most impactful, small, silly little things that I got out of 2 years working with them that has changed my business is what real estate agents do. It's what Kevin, your guy, does. He sends these mailers. This is mine right here. This is made for real estate agents. It's these dimensions because it fits in a normal envelope. So when we talk about the price to go out, we're dropping mail cost, and we know the cost for each one of these to go out. And when we sign a new agency, I mail one of these to every single contact whose name I have at that agency. And then every quarter, we resend them out to every contact and the new people that came in that work at those agencies. And I swear to you, every time I visit an agency and I'm talking to them in their office, this is sitting on the desk of every single person there with their notes. And it says, we love referrals, and it has our company name and our phone number and send referrals.
Just in case somebody's listening to this instead of watching it, what can you describe that? It looks like a pad. What is it?
That's all it is. It's the same pad that you have on any desk where you scribble your notes, and it has our company name, phone number. At the bottom, it says send referrals to, and it has our staffing email. And I'll tell you, like, I know the cost of these. It's very cheap. We send them out all the time. Often we'll have an agency where we haven't gotten a referral in 6, 9, 12 months. We send these out. 2 days later, magic we talked about earlier, magically, we get 5 referrals from that agency. They just needed a reminder that we existed. Sometimes there's a change and like they don't even know that they're contracted with us. And they're so thankful that they realize they now have a company that they can rely on. But they needed that reminder.
Well, it speaks to this, like, I wish I had taken more psychology classes in college, but I just wasn't mentally wired for it at the time. But this is a concept that's called mental availability. And what you're really talking, it's called mental availability. And what it is this idea that, you and I cannot predict when, like, let's use referrals as an example. In a perfect world, if you and I knew that every human in our industry thinks about referrals at 3 p.m. Eastern time or whatever on Tuesdays, then we could bombard them at 2:59 p.m. with pay-per-click ads and a courier that drops off flyers and bottles of Dom and stuff like that, right? But the reality is that and this is true in any business, but let's just use this example. You don't know what these people are doing sitting in their cubicles or in their offices or their home offices or whatever. Like, you have no idea what their day looks like. So in other words, you can't predict when they actually think about the need to make a referral. But when that need arises, maybe it's a patient, maybe it's their sister-in-law that's like, where do I go? Now, all of a sudden, they are sitting there as a human being in the spotlight for that 3 seconds asking themselves, what do I do next? And the concept of mental availability is they only will take action based on the things that are aware to them. And so in other words, if you the way to explain this is because your logo happens to be at the desktop at the desk right there, it is probably going to make you part of the mental availability. Like now all of a sudden it's like, oh yeah, just send them right there. Just send them right there, right? It's sort of like the same reason why like you ever think about like, so okay, I know we're running a little bit long, but I'll just kind of finish this thought real quick. A long time ago, so I'm a nerd. I like my wife jokes I can't enjoy anything because I see a business and I just like have to know how it works. So one of the really I do a lot of weird nerdy things. One of those many things is like if I have time, I'll listen in to public earnings calls. So for the finance nerds out there, publicly traded companies do have to tell their shareholders, like they have to get on a call and it's usually pre-recorded and all that stuff. But so I'll just listen to these calls because you can get the content of the call usually as a transcript later, like you can read it, but what you'll never get is the inflections and the annoyance and the tone, right? So you have to listen in on it while you're doing other work. So years ago, I was listening in on a call. It was like a GE call or something like that, right? Real quick, pop quiz. What does GE make? Like, what's the first thing in your mind that comes to, like, what do you think GE makes just as a normal dude?
Most people are going to say the refrigerators, but we also know they have the huge industry in, God, I can't believe
Oh, dude, they make medical
propeller?
devices. I mean, they're a conglomerate, right? They make medical devices. They make jet engines. They make all these things.
Yeah, that's what I said. Propellers or jet engines. That's the other piece that I knew about.
So years ago, this is probably like 20 years ago, maybe 15 years ago, I'm listening in on one of these quarterly calls. And it was anyway, long story short, they're going through their financials. And then there's a period near the end of the call where like analysts, and these are like people that work at like JP Morgan or whatever that are allowed to then ask one or two questions. So here you go. You hear somebody come off mute because these are always, at least the ones I've listened to, they're phone calls, right? So here we go. Okay, anybody have any questions? Boom, I can hear somebody come off mute. And I just imagine that this is like a 24, no offense to anybody on age, but here, I just in my mind, I was thinking like, this sounds like a 24-year-old that has like an MBA that's like the ink hasn't even dried on this MBA. So this MBA comes off of mute and goes, I see that the advertising budget for the engine line or whatever you call it, the jet engine business, the advertising budget is X or Y. Why are we spending so much? As a percentage, it was like 60% of the advertising budget for jet engines was consumer facing, not corporate facing. And so the question he asked, and he asked it in a very smart sounding way, but for me, talking like a second grader, basically what he was saying was, you sell jet engines to aircraft manufacturers, but why is the marketing budget so heavy on the consumer side? And so then he goes, thank you for your time. And then he goes on mute. Okay, now the executive, I could tell he was about to sigh, but he came off of mute so fast that you heard him sigh. So he hits the mute button, it comes off of mute, and he should have waited about 3 seconds, but he comes off of mute. And really I'm pretty sure I caught the tail end of an F-bomb. And he goes, he said something, and he said it so succinctly. He goes, he said something like, and he said it without being sarcastic, which I thought was the real superpower. I would have been a total dick. But he goes, look, we sell refrigerators, we sell TVs, we sell washing machines, we sell, all these things, whatever. And he goes, here's the thing. Imagine that you are on a Boeing or an Airbus aircraft that happens to have our GE engines on it. Look, one example of how we deploy that marketing budget is that we pay the airline to print the GE logo on the inside of the nacelle facing the passengers. And if you want me to explain to you, and this is him talking, he's like, if you want me to explain to you how that particular print and by the way, like printing on an aircraft is not cheap, right? Because it's got to be FAA approved and all that. We're talking like thousands of dollars to put a GE logo that's like, 12 inches by 12 inches on the inside of an engine cell facing the thing. So then he goes on to say, and this all happened within like 1 minute. He goes, now imagine you and me as regular parents. He goes, imagine your fridge just died. And you just walked into your local Best Buy or your local Walmart or whatever it is, your local electronics store, and now you got to pick a fridge. And you better do it quick because your fridge is the food in the fridge is going to spoil. You got to pick. when you walk in there, you're going to buy a fridge every 5, 10, 20 years, whatever it is. But to you as an average person that has no time to do any research, because remember, the food's spoiling, they all look the same. The GE fridge and the LG fridge and the Samsung fridge, they look the same. The real question is which one is available right away? Because you got to fix the problem, but also which one do you like more? And then he goes on to say, look, the reality is the reason why we put the logo on the inside of the engine bay is because whether you're on that plane going on a vacation that you and your spouse have talked about your whole life, or you're on that plane working on an important presentation, you're on that plane because you're going to go do something. And every image that you see is seared into your brain, whether you know it or not. And then he goes on to say, like, it's the same reason why when you get a sonogram of your unborn child from a GE device, it's got the GE logo on the printout. Makes no sense on paper, but ultimately, when you're going to buy a consumer electronic appliance and you don't know how to pick on features, you do eventually pick on brand. And which one do you trust more? Now, and so he said it much more eloquently. And I remember like listening to this and I was like multitasking. And as he was going through this, I like paused and I'm listening to this and I'm like, holy cow, this is crazy. And now I tie it back to this topic, right? It's like, I, as a average patient of PT, I don't care, respectfully, I don't care where my PT went to school, right? Like, yet their office will have the diploma where they went to school and all. I don't know who they're putting it there for, but it's certainly not for me. I care, and I'll just use myself as an example. I go to this one guy out of my way because, like, on paper, he's probably trained just like every other PT. Like, on paper, to me as a patient, a PT is a PT, right? But he talks to me about outcomes that I want. And like, that is such a subtle little thing that, like, I was just in there actually 3 weeks ago. And I was like, yeah, man, my left knee's, not feeling right. And I got this marathon coming up in March. So I got, at the time of this recording, I was like, I'm like, I got 9 weeks, 10 weeks to be ready. And he goes, hey, what was your time on your last marathon? I said, oh yeah, it was 3:18. He's like, okay, good news. Or he goes, first of all, same deal as usual. You're going to have to give me 5 or 6 visits on this. It's covered by your insurance because you got to give me 5 or 6 visits. If you do not, you will not get a 3:18. You will not be running that marathon. So now he's anchored it right there. And he goes, so like, that's the thing. First off, Paul, you got to give me those 5 or 6 visits. If you commit to that, I can get you ready for that thing and you'll be able to finish that race. And then after you complete those, let's put together a plan on how we're going to get you to 3:15. That's a cash pay thing, by the way. That second part is the total cash plan. Like, I know what that means now, right? But the point is, it's like he basically didn't talk about PT at all. He talked about what I wanted and then how I could get there. And you're nodding because like you've been doing this for so long. But I think this is the core concept that a lot of PTs and clinicians, I should say, haven't really connected the dots on. Like yeah, I think I read a stat that like something like 44% of clinicians are actively trying to get out of the industry, and that's because they're probably, yeah, like and it all has to do with like, they're not getting paid enough. Right. And, I think the thing about it is like, the reality is if you want to get paid more, you don't have to go start a clinic. Like, that's maybe one path to go do it, but you do have to kind of like figure out how to give patients what they want more of. Maybe that's a different episode. Anyway, I've gone super long. I want to be respectful of your time. But before I convince you to, I won't ask you on the air here real quick, but before I eventually ask you if you want to go do another episode, because I think we could probably talk about like this business school idea. We could probably talk about more tactics. If people want to find you or learn more about what you're doing, obviously we'll put links to your Instagram, LinkedIn, the website, all that. But how should they reach you? Is it one of those 3 channels? Is it some other way? How should they reach you?
For sure, Instagram is the best place to follow me. That's like my main channel. You can follow me at Zack Pevnick PT. That's ZACHPEVNICK PT. On Instagram. I also have a free Facebook group for people that want to get into home health, want to learn how to make more money as a therapist or how to start a home health therapy staffing company. It's called Home Health Leaders. It's free on Facebook. So those are the 2 main places to find more information about me.
I love it, man. Not that I want to get the last word on this, but like the fact that you actually know how to like you've clearly done this a while it's like, man, if I hope people watching this or listening to this, if they take one thing away, whether you're like a clinician, in somebody else's shop or you own your own practice, like that's an example of like being able to market. You got to be able to just riff on that, like just as casually as you just did. Here's how you find me. Bam, bam, bam. I don't know. It's just one of those things. It's like so simple and yet it's overlooked all the time. So, anyway, that was a poorly veiled.
I got to give you one last thing.
Yeah, I love it.
I don't want to take the last thing either, but I got to bring this up because you're gonna get a kick out of this. I'm a home health guy. Like my business is home health. It's what I love. That's my whole thing, and I've gone super deep on that. With PDGM, huge regulatory change happening in 2020, like I had to hedge in case it was as bad as everybody thought. I had to have a backup plan. Yep. We got credentialed in outpatient Part B, and I did mobile outpatient as a supplemental vertical to my company for 2 years. And I used Strata, and it's an amazing EMR. So,
awesome! Yeah, that's awesome, man.
I thought it was pretty funny. I don't think you knew that I was a customer, but
I did not.
I'm trained in like 13 EMRs. Strata is like super, super good. So I just wanted to give you
thank you. That's
a
awesome.
little nod there.
Oh, well, now I feel embarrassed. I should have known that, but I'm sorry. That's awesome. Good. That's awesome. All right, man. Well, I will convince you to come back to the show and let's talk more tactics too. Cause I think, I just find it refreshing that you're willing to talk about this stuff so casually and openly. And I think more people need to hear the message. So I think it's great. I love it.
Thank you. Appreciate you having me on.
Thanks for listening to another episode of Strata Stories. Strata PT combines your EMR and billing into one automated system to increase revenue and achieve a 99.99% reimbursement rate for physical, occupational, and speech therapy clinics. If you'd like to learn more about Strata PT and see how our EMR and billing services work, head over to stratapt.com to book a demo.